So good morning, everyone. Welcome to Wiped Out and Still Going, Preventing Compassion Fatigue. And I thought that wiped out and still going kind of speaks to probably maybe all of us at some time or another, if not regularly. So really a good topic to um, unpack and really explore for ourselves. So this is the perfect timing of the year, especially for this anyway. So thank you all for being here. My name is Diane Padilla. I will be your trainer for the next little while that we are together. Let me go through some of the logistics. This is a slide acknowledging that we are from the Addiction Technology Transfer Network, and I'll give you some more information about that. I have, early on, I have this. So we are from the Technology Transfer Center. What we do is we provide a lot of trainings in workforce support and technical assistance, implementation, capacity building initiative support, all that types of things like that. Everything we do, we try to incorporate the people first philosophy of using terminology and words. And we know the stigma really is still a very noted barrier to a lot of people seeking care. And that's why we make a point of presenting the slide every single time. So words do have power, and we try to use affirming, empowering language to let the communities in need to understand that we are definitely there to support them. And so sometimes we can actually be more intentional in our own terminology and what words we use and evolve the words that we use to be stigma-free. And so that's why that slide is there. So the certificates of completion. At the end of the session, before we sign off, you're committed to being here from 10 to 1 Eastern time. And so we'll stop a couple of minutes before, at least just enough time to give you a chance to fill out an online evaluation, our own version of the GIPR, which we need to kind of count heads, count numbers, just to ensure that this was a good use of the resource, because we do provide these trainings for free. And so this is another way of making sure that you are also present and justifying that you received that certificate for us sending out that certificate. The certificate will be sent along with a copy of the slides. My slides tend to be cited, and they tend to provide other opportunities for more information if you so want to do that. And so you have some opportunities here. And there'll be a slide at the end with some resources. So this webinar is approved for 3 hours of CASAC, CPP, CPS credentialing. There is reciprocity across most states. You have to attend the entire session, but you also have to be present for the entire session. So we're going to need your help with that. And so, and I'll go into that in a second. Prevention Technology Transfer Center, I should have changed that. So under both contracts, we are coming out from New York State Psychiatric Institute at Columbia University Medical Center. Disclaimer, I have to have it. Most of our individuals who do presentations do have to have a disclaimer of some sort. And so this is what SAMHSA lets everybody know, is that they fund us to do this. It's up to us to make sure that we give you the credible, current, most innovative information. And we have a really nice reputation of doing that, of providing cutting edge, skills-based information for you to develop your own competencies, to either sustain them or enhance them, because new strategies are coming out all the time. And we are so invested in ensuring that you that we promote the best practices for you and all that work you do with communities in need. And so that's why the SAMHSA funds the Technology Transfer Centers. They do one for addiction, for prevention, and another one for mental health. Because those three disciplines always intersect with one another, and so they fund those streams, those disciplines. They want you to keep your credentials and your licenses so you can continue doing that work, and so they want to give you the continuing education credits and all the latest information to make sure that you are getting the support you need as a professional. So few things here. So it's nice to see everyone. I just kind of want everybody's putting in their name and their very good and their agencies. Thank you so much. So one of the things, because we have a nice amount of folks, if you're okay with it, we can use our electronic hands. We're okay with using electronic hands? Yes? No? Maybe think about it. Oh, great. Thank you. I can't see everybody's box, unfortunately. And I do see a lot of faces, which is wonderful. It's a great way to justify that you're here. I can see that. Not everyone's face is being shown. So we'll need to assert that you are actually live here participating. And so it's great to have the electronic hand come up because sometimes the conversation can get can become very, very robust. I come from the school of this, any kind of training really comes to life and becomes the most relevant when you bring your own experiences into this. And you don't always have opportunity to kind of voice some of the situations and experiences that you've gone through or you go through. And so this may be a platform for that. It's not a support group. That's not what I mean. But this may be the place where you can voice where you may not necessarily have that ability readily available for you. You may not always have that space. So today we're going to talk about, guess what? Us. So that's kind of neat. So that's why I'm saying, because that's why I'm thinking like this might be an opportunity for you folks to share if you want to. And nothing questions that I ask you, I like to encourage encourage an interactive dialogue throughout a presentation or training, but it's really up to you what you want to participate in. No one's forced to say anything. No one's forced to do anything. And a lot of times, some of you are comfortable just using the chat box, which is nice. By the way, so if you've used, if there's more than one person sharing a computer, please include the names of everybody using that computer, okay? We are very much invested in making sure that you are accounted for in your time here. So the other thing is, okay, muting and unmuting, we have that opportunity to do that. So you folks, connectivity issues are already put to you to the gentleman who is a good resource for you, which is Clyde. So camera, visual, and participation. If I lose my signal, I will be right back. I always have a backup system. The weather right now where I'm at it's not as bad as the weather forecast had indicated it would be. Not yet. So that's good. So that means I probably will remain stable. If that happens in your area, then we just encourage you to just come back. Okay. All right. So any questions, anything that you may want to add here?
Quickly, what do we do if we need to jump off for just a minute for medication? Assuming we can close our camera.
You can close your camera, come right, don't not go up, and just come right back.
Perfect.
Okay.
Yeah. 9 o'clock.
Thank you, Teresa. And seeing how you brought that up, it also triggered another story. There are times when we are on this platform, whether we're in an in-person training or we're on an online training, and we don't have that that hat that we wear when we are active and we are in high stress and we are in work mode where we are so heightened about focusing on this responsibility and on the issues that you're going to deal with this particular client. And sometimes we kind of relax a little bit here. If for any reason, and I'm not necessarily thinking that it would happen, but if for any reason, some issues, some feelings kind of get triggered up within you, what do you think you can do to take care of yourself? Take off the headphone, walk away. Okay, that's a good suggestion. Step away. Very similar to what Teresa was saying. I'm sorry, go ahead. Who was saying something?
No, I said something, but I kind of didn't catch the question. I'm sorry.
So let's say we're speaking on a situation. Let's say a scenario or some comments kind of kick up or trigger some feelings, because when we're in a training, we tend to relax a little bit. We're not as guarded, we're not as protected the way we typically are, for instance, when we're doing the direct services, when we're in that environment. And so let's just say, maybe even in your weariness, some feelings trigger. What would you do? Since we're on this training, if something here triggers you, you might consider maybe stepping away, like everybody's saying in the chat box, or what Teresa was mentioning, for a specific reason. It could certainly be an option for when you are going through any feelings. You can close, shut down the camera and not log off, step away, do some deep breathing. I would encourage slow exhales that will bring your body to, your body functions will bring it back to a calm state. And when you're ready, you come back. So it happens every once in a while. It happens. It's not always, because it's specific topics that are very difficult to discuss. It's not always trauma. It's not always race-based. It's sometimes it could be just a time of year. It could just be because you're feeling the weight of the workload all this year. And the end of the year tends to be a marker in most people's minds. So that's something that you may want to consider while we're here. And this is also part of the reason why we're discussing this topic. Okay, so I'm very much interested in you taking care of yourself so you can't come back and you can't internalize this information. So, so whatever it is you think you can do in that moment, if that's a good suggestion for you, great. If you want to add some more suggestions, do that. I think between the stepping away for a moment and doing the breathing, that is huge. Personal experience, it has been very, very, very helpful. And so, okay. Okay, so then I think we cover some logistics, and hopefully the other thing is that anytime, if you could be on camera, please do. We try to find different ways that you can be, that we can confirm that you're actually here. If you can't be on camera and you participate in the chat, that's great too. Okay, so it's really up to you. I also know that some professionals are in an environment with so much movement back and forth, and you may be uncomfortable being on camera. I understand that too. Okay, just send me a note and just let me know, and we'll go from there. All right, I will definitely try to work with you. So let me go and, all right, so what are the goals today? So I'm going to ask everyone to just have maybe like a medium-sized paper like this, small, and a pen, and have it available. There are certain questions that I'm going to ask you for you to make a notation on your own paper, not necessary to share out here. We have a lot of content to go through that. You just have something available. This is just for you, for your eyes only for now, okay? All right, so let me start here. So our goals today, we just want to review what are some of the factors that really put pressure on us as professionals, that particularly because they have a cumulative effect and an impact. And so we're going to kind of explore some of those, and it can be very individualized, or maybe you might find how common it may be amongst all of us. And that way it could lead us to hopefully looking at how to build capacity within ourselves and for our own self-preservation, our own wellness. So this we're going to use from both perspectives, for ourselves personally and professionally. So it's also how it will result or consequently impact the care you give to the clients or the people in need that you provide services to. And so here I'm going to start asking you the first question I'm going to ask you to write on your notepad or that piece of paper. Just take a few seconds to think about, when you think about your work, think one thing that you're good at. I am good at ... Whatever that is, I'm going to give you like a few seconds to kind of think about. You probably are good at a variety of different things. Just name one and write that down. And then when you let me know when you have written all that down. Are we good? You should be good, right? Okay, great. Excellent. So let me start here. Good. And we'll hold on to that paper. We'll come back to it. All right. So here's some of the challenges about the workforce and the world that you are providing services from. So in terms of the workforce, I'm not so sure that anybody is working in the behavioral health field, one arm or another, that is not aware of the shortage of workforce. I mean, we knew this before the pandemic, and these numbers were exacerbated since the pandemic. We know that 1 in 5 adults experience a mental health condition each year. And we know that there's a smaller percentage, maybe 40%, of people who actually access care. More than 19 million Americans struggle with substance use disorders. And so when you look at some of the data resources, that tends to be anywhere between 20 and 22 million that might receive treatment. But we know that often up to 25 million any given year actually have a substance use disorder. But if we're only giving 11% receive treatment, there's a lot of people, not just the people who do receive treatment, but a lot of other people also not accessing care, who are dealing with substance use related symptoms and probably a lot of stress behind that. So extra pressure on professionals to do more within the same parameters. I remember a time when I was still doing direct services where managed care kind of came in and tried to tell us that we have to do 15 minutes of work in 5 minutes. It hasn't changed. I think that has been enforced quite a bit in different realms. But the challenge is, even if you did have the time, even if you do have the 15, 30, 45 minutes, because there are different protocols we do have to engage in that we have time for. The challenge here is that a lot of times you tend to cover more than the caseload that you should have. Ideally, under your job description, most professionals should have a certain amount of clients or patients on their caseload, and many times that's superseded, sometimes 100%. And so that's those numbers are really high. And there was some reason I was doing some research for this other development project, and I was looking at the numbers, the substance use disorder, actually the one specific to opioid overdoses. And we know we've seen a huge increase amongst different groups, but particularly the youth. And very often these folks are dealing with a lot of mental health issues, depression and anxiety, and it's not always so readily diagnosable for a lot of folks. And even for those young people who do have diagnosis, maybe 1 to every 1,000 in the youth or young or adolescents who do have a mental health disorder, 1 to every 1,000 is a mental health practitioner who is whose expertise is working with the youth population. I mean, we are so on demand in the different disciplines. With all the work that you folks are doing, you're consistently seeing the different mental health, the different substance use related issues within the communities. It's constant in your world, and yet we're only seeing just a small fraction of the individuals who need care. And you also see a lot more for every one professional. And so that really kind of paints out a picture, a real high pressure picture of the environment that you work in. So if you want to add to here, that's fine. So what I'm going to ask someone to do here is, Athena, would you like to do that? Would you like to read first? Thank you.
I can read. It's Alejandra if you'd like.
Sure, please.
It's late evening and the glow of your desk lamp is the only light on. You promised yourself you'd stop an hour ago, yet here you are reviewing client notes and planning sessions. You're dedicated and passionate about helping others, but the blurred lines between personal and professional life turn your passion into exhaustion.
Thank you. Sound familiar to anyone? If it sounds familiar to you, please thumbs up. Okay. It's the unfortunate part of the work that we do that we're so dedicated, but the unfortunate part is that sometimes we go beyond the lines. And so it's interesting because it's easy kind of to get caught up, especially when you ever feel like you ever find your zone, like you're like zoned in now, you're totally focused, and like you don't want anything to distract because you're accomplishing so much and you're so into it. And then you lose time, you lose track of the time, and you lose track of the fact that maybe you lost a meal somewhere. Then you lose track of, oh, wait a minute, you were supposed to do something at a certain time. So those things are something that probably is very familiar to some of us or have happened at some point or another. So I want you to answer another question. What is thinking about that. What is the most important factor for client-patient care? What comes to mind? And I'd like you to put that in the chat box. What do you think is the most important thing that you bring to your job? Okay, the work use disorder, the balance, boundaries, safety, communication. Oh my gosh, these are wonderful. Okay. 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 Very good. Appreciate. There's just way too many for me to read everyone's, but we see a lot of compassion, trust, boundaries, listening skills. I saw empathy so many times there. I saw being present also. Yeah, I like what Athena put. Okay, so here's what I'm going to show you, and you tell me how you feel about this. Okay. The most important factor for client-patient care. Well, you are. It's amazing how we can think about all the different attributes and skill sets that we need to have in order to take care of, in order to support someone else. Sometimes I say take care because I think about the professional caregivers that you are, but you are the most important factor. It's not just what you bring, it's you, the person. And I think it's really important for us to begin to remind ourselves, or at least to start to consider that before you can even bring everything that you need to bring for that individual, and we know that the client or the patient is the person that leads off, we have to be person-centered and totally present and presently focused on the individual. But for all that to happen, you have to bring you. So you are the most important person. You are the person that you are the most important factor in that relationship in terms of service provision, in terms of everything you do for other individuals. It's you. So I want to encourage you to kind of borrow that idea. Just to borrow that idea just for a little bit, especially if it seems slightly uncomfortable right now. Okay, so there's some good messages here. Some other good messages. Anchor self-care, limit peer drift. Okay, sometimes I've just logged it. Okay, no problem. So let's talk about this. Here, you're in the helping professions. You have the ability to effectively and compassionately communicate with patients and families. And that takes a lot of ability, and skill sets to be able to do that for absolutely every single person that you are engaging with, and I'm not thinking about your peers as much as I'm thinking about clients who come in with different situations. You can have like 10 clients who have an opioid use disorder, maybe even have the same level of, or a substance use disorder, and have the same, even moderate levels of severity, and you will have 10 different worlds and pathways into the world of addiction. And so the ability to be able to communicate with your clients, with the support systems, and all that really takes a lot of energy on your part, a lot of focus on your part. And so you provide that quality health and behavioral healthcare services and recovery supports that is needed on an individual basis. You also demonstrate compassion, integrity, and respect. We also do that. We engage. There's so many layers to what anything that you do for any given person you're providing services to. It also includes the respect for privacy, being guarded, understanding the do's and don'ts about confidentiality and the HIPAA laws, and even how to discern between that and mandated reporting, and also respecting the individual's autonomy, their right to choice, based on the information we provide. And so you see how it kind of starts to, like, there's so many layers and so many different trajectories here. So it's about applying the principles of ethics and decision making. And so to be able to intervene effectively, even and professionally, for any type of substance use, even mental health issues. Sometimes it's partner violence, sometimes it is immigrant-related issues of trauma, or other kinds of trauma, disaster situations, and so on. And so it's not the easiest thing to do, but you folks are doing it and do a really great job at it. And so it takes so much energy to be totally present and really conscious about how you strategically use your energies and your skill sets to support any given person. And this is just, I don't even think this really covers all of it. So let me ask you a question. We're going to start to speak to compassion fatigue. Clyde, would you like to put up that poll, please? So did you know that did you consider the question? Did you also know that isolation is part of it? Yes. Did you also know that working more is also a symptom of compassion fatigue? So, and because a lot of times we have a way of maybe coming up with such a good reason for why we need to work more. There are a whole bunch of different reasons. And so let me ask you, why do people continue to work beyond weariness? That's the main question. Why do people continue to work beyond weariness? What are your thoughts? You can share here. You can raise your hand and share. What are some realistic motivations? I like what Jonathan said, to make money, because that's a big rationale. Who had their hand up? Was that Jeanette?
Yes, it was me.
Yeah. What would you like to add?
I was gonna say distraction. I mean, I know for me, at least, if I am working more and things of that nature, it could definitely be to distract me
from something else you don't want to deal with at the moment?
Yes.
Okay. I can see that. Okay, we'll take that.
I think early in compassion fatigue too, like she was just saying, you don't know why you feel awful, but you feel awful, so you work more because you think that will fix it, even though that's the root of it.
So could you repeat that just a little again? I missed some of it, Emma.
I said, I think early on in compassion fatigue, you don't know that it's compassion fatigue.
Right.
You feel awful and there's something unsettled. So you work more because you do think that will fix it, not really knowing that's the root of it.
Mm-hmm. Interesting. That's good. Thank you. Kelsey?
Yeah, I think that there's just a pressure in the society we live in to work hard. That hard work is what pays off. And then I think sometimes there's this pressure to commit more, to work harder, when what we actually need is a break and some time to, stop and think and take care of ourselves.
Thanks for saying that. I like all the comments so far, but let me just kind of just maybe add to your comment, Kelsey. I wonder, and to everybody, I wonder how much of this is the conditioning or the societal attitudes that we've internalized. Very much like Kelsey was saying about, if you don't work hard, you're not really interested, or you're not really good at your job. Or these things, like, we don't want to be perceived as incompetent, or we don't want to be perceived as we don't care about the people we work with, and so we work hard. And how much is this is more about what we absorb from our environment, and not necessarily what we're really doing. And so being able to discern between that can be so interesting. Yeah, to avoid guilt. Very good. Jeanette, go ahead. Good morning.
Good morning. Yes, well, I know I do. I always think about, I'm always putting my clients first, but then I'm like, I need to get this done. I need to get that done. But at the same time, I'm so overworked, but I'm always thinking about them instead of thinking about myself.
Mm.
And that's when I'm overworking myself at the same time.
Yeah. And I think and thank you for saying that. I think that's what happens with a lot of you folks. I was doing direct services. I think even for some of us who are not doing direct services anymore, we have a different way. We're not even doing working directly with the communities in need, and yet a lot of those comments and like what Jeanette just said is very much part of what we internalize on ourselves. So different arms of the workforce are absorbing these different ideas and want to counteract that by working harder. And it's always, yeah. So if the client needs, and we know that we are trying to tailor the supports very specifically to the needs, and that is very different on each person, that can be so energy draining. But yet you come with a lot of empathy. That's the job, right? That's part of the job. I wanted to read something here that, let's see, where was it? I was talking to someone who mentioned about they run a program. Oh, I run an entire program. I never want to fall behind. If I fall behind, so I to catch up. How much is that a reality in everybody's world? If you, it's like it's interesting because even when you're not feeling well and you're entitled to take your sick day, let's just say that. I'm not even thinking about compassion fatigue. Lots of times we won't take it because they're catching up. It takes forever, or it's almost impossible once you let go. It's like, don't let go of that ball. Don't let go of the ball because you will never get it back. It's kind of like that thinking. And so yeah, feeling guilty of calling in, especially if we know that that means that someone else has to cover for our folks, and our responsibilities without being prepared, and we don't feel good about that either. Yeah. Well, there's so many things that are really pushing and pulling us in different ways. And so a lot of folks will work beyond weariness because they feel like the job calls for it, because they don't want to fall behind. Some folks might consider, and this is something I've heard before, that some folks might actually think that they may be perceived as not doing enough. Nobody wants to put their job on the line, and it's not like you have, and it's not one of the reasons why I put the shortage information up front is because you folks are that needed. You are that needed because it's not a lot of people banging down the door to do the work that you do. As much as people love doing this, it takes a lot of energy, a lot of expertise, and a lot of, a lot of commitment to do this. And so, let's see, if I call in, I'm just going to have to work to catch up. Management as well might suffer through it. Yes, thank you. Jessica, go ahead.
I struggle with sometimes knowing the privilege that I have in life just by circumstance, right? That when meeting these clients who've had so much against them and so much adversity and trauma and all these things, I feel like I owe it, I don't know, to society, to people, to whatever, like to use my privilege for good. And so then I feel like when I am not like 150% overworking, exhausting everything, right? That somehow I'm letting, I don't know, people down. Maybe that's so.
It's interesting that thinking, as you folks seem to have such empathetic hearts, such big hearts, and you're very aware of your privilege, but thinking of it in the sense of feeling like that can actually be a barrier for you to take care of yourself. That's interesting. I can totally understand that. Let me just go to my slides and we'll keep on from there because I think these comments are really great and this is foundational to where we're going. And so there's a lot of awareness of different things, different reasons, and this could change at different times throughout, in your career as to what kind of like adds to your reasoning for working beyond the obvious weariness that you are experiencing. Because sometimes we are not so much aware, but many times we are, and we continue, and we push forward anyway. So we know that the therapeutic alliance is essential to what you do. We know that patient activation refers to a person's willingness to take responsibility for their wellness and a recovery process. That has a lot to do with how you connect with an individual who's seeking care, how you are able to partner up with them. The key components of that therapeutic alliance includes being able to be intimate with the individual to a certain degree, balancing the power dynamics because you're not necessarily you're not as effective if you are the person of authority and the person is in need, and then it can become a directed process. Being person-centered and partnering with that individual really takes an intentional commitment to actually balance that out. So the empathy that you bring, that takes a lot of energy, and focused, mindset. And respect and trust. And respect is not, and I always say this, so excuse me if you've heard this like 100 times before, but respect is more than not being rude. Respect is like when you elicit information from the individual to understand what is going on in their world, to be able to integrate that in how you move forward to what, as you are developing a treatment plan, as you're matching resources to address certain needs that they identify. Respect means you're including those perspectives and those desires and those strengths from that individual. And so that even just by itself takes a lot of energy. But when you think about all of this, how it comes together along with building trust, there's a lot of energy going into this and very, very specifically tailored for every person. Well, when it comes to empathy, empathy is something that we all seem to have at the heart of who we are and what makes us so good at what we do. It's a complex, cognitive, and effective process that allows humans to experience concern for others. And that's foundational to that therapeutic alliance I was just discussing. So it's a way to comprehend or relate to the emotions that someone else is feeling, and eventually help them. And this is one way. Sometimes compassion is actually defined this way. It's true. Where empathy, you can feel for the other emotions, and compassion is you want to do something about it. You can feel for the emotion, but you want to do something. But empathy is the very thing that helps you connect with that individual, helps you create a safe space, and is essential to, the highest levels of quality care for individuals. And so in that process, you are absorbing quite a bit. You are facilitating sessions with different individuals. There's a lot of dynamics that you manage when you are facilitating a group. There are different perspectives. There's a topic that you're addressing, some concerns, some feelings come up. You have to actually navigate that and kind of keep everything focused and while taking care of your clients at the same time. Not the easiest thing to do, but you get really good at it. Listening to stories, being present with many of you mentioned this, being present with another individual, it means that you are going to also going to a certain extent maybe relate to that. Maybe sometimes even just listening is a way of absorbing that. It starts to accumulate in us and we feel for other people, but all that kind of starts to have its own impact. Collecting data is part of the efforts to intervene and identify issues, providing the services with kindness and empathy. This is what we are encouraged to do. The crisis interventions, how many times have we had, okay, so we know our routine, we know what our day is going to look like, we go in there and it looks like anything but. There's crises coming up at different times. There may not be any, able to follow the usual protocols in terms of how to address them. It might have to be an immediate thing, being like hyper available right in the moment to do what may need to do. All of that is being absorbed by the individual. And so when we think about that, and yet we still do the job we do. So we still love what we do because you're still in the same profession. Everybody here is on the platform. You are here because you like what you're doing, and you're here also to collect continuing education credits. But hopefully you're also going to be able to discuss a topic that you may be able to walk away with a couple of strategies to help yourself in this process so you can stay here, stay doing what you're doing. So in that sense, let me ask you, Sean, in that piece of paper that you have on the side, take a few seconds and think about, and despite the fact that you absorb all this and you work with different clients and you're good at what you do, name one thing see if you can identify one thing, a favorite part of your job. What is the favorite part of your job? And write that down on that piece of paper. All right. Okay. So now you have that written down. Very good. All right. So now I'm going to go to my next question. I'm going to ask Clyde to put up that second poll. Thank you, Clyde. When we think about compassion fatigue, there's also another phrase called empathetic strain. And so what, the data has been coming up with different words. Words after was tend to indicate a certain definition. For our purposes, it is the emotional residue, or I like another word too. It's emotional psychological erosion of, of our capacity to be compassionate, and or the strain of exposure to working with those suffering from consequences of traumatic events, substance use disorder related events, mental health related events, and those experiences that they bring. It's the constant exposure of that. And so we do know that it has been described by Charles Figley, a very well-known psychologists in the field, as the cost of caring for others. It is a type of stress that involves physical and emotional depletion. And so people experiencing compassion fatigue usually display a lack of empathy. And so that's why that previous post, going from empathetic to apathetic, is the appropriate answer. And a lot of times it has some, it may seem, or you may not notice, sometimes we're not aware of this, but it can seem to say the recipient that you may seem indifferent. Maybe not necessarily flat fact, but maybe not necessarily showing empathy, which is a good difference. And so for a client, that can be very, can be not harmful, but it's not necessarily helpful if you cannot understand, what they're feeling, what they're going through. It can impact their ability to share with you. And so it can actually take us there. So it refers to the profound emotional physical exhaustion that professionals, caretakers can develop over time, and particularly over time over this field, which is why we talk about compassion fatigue and certain healthy activities to kind of mitigate the impact. It's normal. It's absolutely normal to feel like overburdened. I'm going to use the words in the title, wiped out, so to speak, when you are in the helping role. It can be very draining. But in most cases, sometimes there are simple ways to just alleviate that. Being able to, my favorite mantra these days is take a step back. Just take a step back. Doesn't even have to be that complicated. We talked about that in the beginning of the webinar, how sometimes that's what we need to do, for different reasons. So trying to help a friend, say, just imagine you're trying to help a friend through like a really tough situation. And that not only affects you, but also them, because you care about them quite a bit, and you want to help them kind of, because you're an expert in what you do, you often are the resource person in your family, your social circle, in your community, to help other individuals outside of your job. And so your expertise can help lessen the impact of the struggle they're going through, but also because not knowing how to help can take away the pain. Not knowing how to help someone can also feel, not necessarily take away the pain, but helps, can feel overwhelming. And so you may end up feeling anxious or exhausted. So compassion fatigue has stress-related symptoms. And these stress-related symptoms are experienced by professional caregivers, and there's a reacting to working with people traumatized or dealing with the various issues. Particularly these days, we are working with people who are overdosed with fentanyl. We are dealing with the situations that are related to individuals who have been using heroin, and xylazine has been part of what they're using, which is consequential ulcerations, which is also challenging for providers. We're working with people with partner violence. We're working with people who we have to be mandated reporters with around child abuse. Not the easiest thing, and this on a consistent basis. And so it has an impact over time. And also it has a more rapid onset while burnout emerges over time. So I'm going to talk about the differences between these terms. Faster recovery, less severe, recognized, managed early. So it is possible that when you are more aware, or at least reminded of some of the signs that you probably are already familiar with, that you can distinguish between the two. And so speaking of these terms, burnout is really, it's a cumulative process marked by emotional exhaustion, withdrawal, but it's not trauma related. It has to do with so much work over time, increased workload, the stress or the pressures that you have from the organization, or from your funding sources to ensure that certain things are done at certain times with the amount of people that you have. And sometimes, that can lead to burnout. And so it's not necessarily psychologically founded, and not not trauma informed. And so it was recognized back in the 70s and among healthcare professionals, but these days, everyone in the behavioral health healthcare system is actually undergoing that. The other thing is vicarious trauma, which is the emotional residue or, exposure to peer professionals or the half from working with people that they're hearing stories from. Like addiction counselors, social workers, mental health practitioners, healthcare providers, peer support specialists. All of you are in the capacity, in a position, and that way you have to listen to some of this to understand how to best support your client. And so when you're consistently hearing stories where the various stressors, and some of them can be pretty extreme, and then you are trying to hear with an empathetic ear and then be able to be supportive and have available options to help support the person at the same time. While you're doing that, within that conversation, you don't necessarily have a lot of time for you to take a few minutes to actually process out what you've heard and how it may have affected you, because your focus is on the other individual. So the vicarious trauma is has the ability to kind of just has the ability to actually over time kind of twist or change the belief systems that providers have. It kind of alters how they view the world, by being repeatedly exposed to it to different degrees with different people. And so what happens is that you kind of feel some of the symptoms for after several months. Just imagine that you are working with an individual where their traumatic experience was something that really had an impact on you and maybe imprinted in your mind. And months later, you're still thinking about that. And so that could be vicarious trauma. What is interesting to note between vicarious trauma and compassion fatigue is that compassion fatigue can occur due to the exposure of one case or over cumulative cases. It really is, it's a little bit different where it's a little bit different where the person can be exposed, but over time is starting to feel certain, like not necessarily flat effect, starting to feel more desensitized. And I've heard that providers talk about that desensitization, desensitizations that can happen with different providers after a time. If you ever felt where you're consistently dealing with so many challenges of newgrass and challenges of the issues that different clients are presenting with, and you're being forthcoming and being supportive for each one, doing the best you can with each one, and you haven't had a chance to process that. What can happen with compassion fatigue is that you're not necessarily aware that you're not as present as you used to be, and that you maybe you're just going through the motions because it's become a routine, because it's become second nature. And so there are neurological systems, that actually play a part. The activation to reflect brain and reactive brain, it's different for each person. There's when the brain gets conditioned to respond is one thing, but when the brain starts to kind of nullify itself and you can't respond, then that is something to maybe raise your awareness about. It's about the witness or suffering of other people and experience or being exposed to people with suffering. It tends to, there's some of the data that kind of speaks to that the lower brain is reactive and speaks to the fight or flight response. And when you have, especially for some extreme cases. And so when we're snapped, they say when we snap at someone or we're short temper with someone, the low brain type of activity kind of gets stuck. And we need to take a step back and kind of see, not necessarily dismiss it or just apologize for it, but actually look at that as a red flag, an opportunity for us to see, okay, what's going on with me? What's going on with me? And this is like, before I can meet with anybody else, I need to do certain things. What do you think you can do if you notice that you were short with someone? What are the resources we have available?
Can I chime in?
Whereas, I didn't see a hand. I'm sorry. Go ahead.
just letting the person know if I did lash out to them, like, I apologize and it has nothing to do with them.
Yeah, that's important to do that. And so, but repeat again the part the first part that you said, because I was reading chat. Go ahead.
Oh, fellowship,
The fellowship.
regrouping. Yeah.
Okay, so kind of reaching out to colleagues, peers, and other folks. Yeah. So I thank you, Jeanette. I see that people in the chat box are actually saying that peer support is helpful. I saw a lot of people who said therapy. So I'm gonna play devil's advocate here. If you don't take the time out to stop and kind of just look at certain things, how do you take time out to go to therapy? Not that I don't think it's a good idea. I'm just kind of trying to work with our realities here. So it's a great idea, that type of support. And I know therapy is involved. There is a admission process, not too dissimilar from how your clients have to come in to access your services. And there's a commitment to meet with people and taking the time out of your schedule. What can you do more immediate at your job? How many of us have clinical supervision available to us? You have peer support, you have clinical supervision support. And let me see, you have said, the discussion with your coworkers, because you all have experience to different degrees on not just in feeling the impact of the work, but also how to mitigate some of that. So we don't always think about how it's helpful for us just to, ask our colleague or ask a coworker to say, listen, I need your ear for a few minutes, just to kind of talk and air out what you're feeling and diminish the intensity of what you're feeling. That can be helpful, at least in the moment. I see. Okay, so if they have, that's great. Asking my coworkers if they have a space for staffing. Okay, mental health day. And do we take our mental health day without feeling guilty? Yes, the self-care aspects is certainly key. We're going to talk about that. So I like that. Okay, so you have hobbies, accountability of therapy appointments. Can you talk a little bit more about that, the accountability of therapy appointments, Jessica?
Yeah, I struggle with self-care because it always feels selfish to do, right? Like kids and the job and all these things going on. If I take a minute to do what I want to do, like, feel like I can't. But having like a regularly scheduled therapy session, like if I cancel, I have to tell somebody else, right? I have to tell my therapist I have to cancel. And that makes me think about, like, do I really need to cancel? Should I go to this? Am I just, trying to work more and not do the self-care that I need to do, not do the processing? So I think for me, having the accountability of somebody else saying, oh, okay, let's find another day is helpful.
Okay, thank you. Thank you so much. That's nice, Terry. You have great support and supervision of coworkers. That's fantastic. Let's see, taking a break with a coworker. Have you ever noticed where you first started at the job? Maybe you have experience with a lot of other places, or this is your first job, doesn't matter. But when you first started, you would have a lunch period, you would go around, check out, what are the restaurants, what are the eateries, what can you deal with, what you can access with your budget. And then over months, over a couple of years, what starts to happen is you start to bring lunch. So you don't leave the premises, you bring lunch. And then you bring lunch and you don't take time out. You don't go to the lunchroom if you have a space, right? You close the door to your office, and you eat at your desk while you're looking at your emails and the case notes. So it's really helpful for us to kind of look at our habits and how they change over time. Some of these are not situations where we can rationalize. If we know how we were when we first started, if we know how we were 2 years in, if we know where we are today, we may be able to kind of access those reference points and see if there's a difference. And meanwhile, we have been just fine with it. That's the other part. We may have been just fine with it, but we've changed. We've changed the time we used to spend with ourselves to disconnect for a few minutes, to take a walk outside, which I understand. If there's 3 feet of snow, you're not going outside. If it's pouring, cats and dogs, you're not going to go outside. But if you do that regularly, and you've changed it over time, is that something to think about? So one of the things that happens is that when you disconnect from what you are so tapped into consistently, you actually give your mind time to kind of debrief. It's like us, like 90 minutes in, what we'll do is we'll take a break, because 90 minutes in is a good amount of time to, like, okay, you have a lot of information, step away, you internalize the information, but you disconnect and get yourself back to another healthy place where you might be open for some more information. It's the same idea during our work time. You're not going to take a lunch period every 90 minutes, but you could step away from your desk. You could step away. You could take a few minutes before you go into the group, or ensure that you have that opportunity so you can disconnect from the very items in the very environment that tends to keep you honed in into that mindset that keeps you focused on all these things that you have to do, all these things that you've heard, and how you can help provide resources for different people. And so sometimes we don't know the value or the benefits of actual disconnecting. Just for a few minutes. It's not going anywhere. It'll be there when you come back. So let's see. Voice notes help me reflect from what I need in the moment to vent and process. Very good. Yes, you lose the boundary between the working you and yourself as a whole person. And that's not unheard of. If any one of us who had gone to school for a lot of these different specific strategies that we use, we understand. Typically, a professor would tell you, or the instructor would tell you, that in the people field, that you should step away every once in a while because you need to replenish. But we think we're pretty healthy. The person is in need, so we want to focus on them, and that's not incorrect. But maybe what we can use some of is a little bit of a tweaking of that aspect. And so as we go along, let me just read to you this next thing, this next slide. And this is, again, Charles Figley. I got much respect for the work he's done. We have not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and curse of extreme empathy, and we suffer. We feel the feelings of our clients, we experience their fears, we dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We aren't sick, but we aren't ourselves. Right there, Charles Figley was giving us a few hints of some of the things that do happen to some of us. So I'm going to ask Darren, would you mind reading this next scenario? Okay.
As an essential worker, you are required to go to the office every other week. Most clients are MOUD, medications for opioid use disorder. Several clients in crisis are coming to see you at the office. You were very impatient with the last client you met with, interrupting them while they discussed their situation with you. You abruptly stopped them mid-sentence and provided them a referral to a stress hotline and ended the meeting. You go home irritated.
Thank you. Thank you for allowing me to put you on the spot.
No problem.
So you folks, what is your take on this? First, does this sound familiar? And what would you suggest with this individual?
Probably a day off. They seem a little burnt out.
Okay. Time for a break. Okay, thank you. And be present and stress hotline journal to find out what needs they have that aren't being met. Some self-compassion. Go ahead, Lindsay.
I think that in this situation, I find myself in this personally quite frequently. Like you just get so to a point you can't pour from an empty cup. So I think at this point, having a I've seen all over social media right now that there's little keychains that say emotional support coworker. Having the emotional support coworker and having someone that you can sit and vent to about all the things of your job that are heavy to you and have them kind of help you put that into perspective. Why did you start this? What were where was your passion at? Where is that love? And find that, reconnect with your purpose, your sense of purpose again, before moving forward with these things. I think that would be helpful.
Yes, thank you, Lindsay. I think and I think part of what you were saying and what I was thinking also was also that when this happens, are we aware that we do this? Because the idea here is if we are aware, can we use that red flag as a moment to not to identify a potential deficiency, but an opportunity. I would be concerned if we experience something like this and then we dismiss it and we keep going on as business as usual. That would be a concern. The fact that you're able to see that, oh, you're behaving a little differently than you usually do. You're a little less impatient, a little less intolerant, a little more abrupt. It's not your style. To be able to dismiss it is a concern, but to be able to identify is like, what's going on? Asking about ourselves and say, let's take a step back and say, what's going on before I meet with the next person? Let me look at why I did that. Sometimes we're not aware because we're so caught up and maybe we have all these pressures. Can someone else pick up on? And I appreciate what was just being shared. Sometimes a colleague can pick up on something and can help us understand. But a lot of times this really has to do with us. Do we have a level of self-awareness to be able to be able to identify that I just did something I don't normally do? And it's not so much that I will risk losing the client's objectivity or receptiveness to my supporting them, but it's that whether or not what I'm going to do with that. Am I going to say, okay, I'm probably going through some things right now, I need to address this. Let me write this down, I'll come back to it later. Or should I do something about it now? Again, taking a moment out to let me come back, let me debrief, and let me regroup. So, all right, I know my position here, but it's very familiar. My last position as manager in retail, retail. My son, say that because he got a lot of fast-paced personalities going through. My self-care was not there. I was frustrated a lot. Yeah. So, and then give yourself a pass. It's okay and informed to feel this way. I find a space to recognize and accept these feelings, put them in the right place, don't overwhelm you. I agree to everything you said, Melissa. I would only add, make sure that I don't take it with me to the next client. That's the only thing I would add. It's okay to feel that way. So thank you for giving us permission to be human. This is a really good reminder. Just don't want to dismiss the fact that you don't want to take it with you to the next person. It's like acknowledge it, recognize it, and say, okay, take a breather, regroup, go again. Because you go forward and more informed, more aware of you, and more aware of where you're at, you're more likely not to allow that to be part of the dynamics that can come up within a conversation with a new person. And see, understanding your reference points to help de-escalate heightened levels of impatience, refer to a coworker, take a moment to process requests, active listening. Remember, we are developing a mutual plan, not a mandate. Thank you, Tishna. Okay, so here's something that might be helpful, and hopefully you've heard of this. It's the stress curve, and so all of us work in a stressful environment, and then whether you visit homes and you work there and you have to do these home visits every once in a while, whether you are totally administrative, whether you're working with in person with individuals from the communities going into the communities, whether it's a constant array of scheduled appointments for folks coming in to see you, stress builds up all types of ways. And stress is not such a bad thing. It really depends. You have to put it in context, really. And so a person who doesn't have enough stress is going to be kind of not very motivated, but maybe not accomplish too much. And so someone who's more laid back may not be as adept in a high-paced environment. So, but stress can be very helpful. It's the very thing that can create the motivation to get up and look forward to work. Actually looking forward to doing what you love to do. It's a beautiful thing when you can do that. and being stressed about making sure you're on time, you don't miss an appointment. That can be that you typically has a certain level of stress, and that can be a healthy thing because it gets you there on time because it makes you present. Meeting your deadlines, understanding, what you can do for different persons, actually channeling that energy appropriately. Now, there is, but sometimes when, have you ever had that feeling where you are so good in your accomplishing a lot in a given day, and you feel like, geez, if there was one more hour to the day, I can get more done. That's not necessarily the healthiest mindset, but if you've ever related to something like that, it means that you're definitely adored. You're doing very much accomplishing a lot, but are you including yourself in that process? So, because many times it's like, oh, we're being productive. We're making sure the notes are done on time. We're making sure we are making the phone calls that we're supposed to do. We're doing the staffing. We're doing the resource matching, And so many times, people think that just because you achieve all these things, it's actually a good way to reduce stress. So that way you don't have that much waiting for you the next day or the next week. And so unfortunately, what happens sometimes is that even though some stress can be beneficial, once you go over a certain line, it can actually lead to fatigue. And so, so there's this thing called the Yerkes-Dodson law that it speaks to the performance, how performance increases in us, due to psychological, mental arousal. So those stress levels can be very helpful, but only to that certain point. And so when the excitation levels, those levels of excitement, when they start to get too high, your performance actually tends to decrease over time. So you don't necessarily achieve as much as you have. And so the best way to enhance arousal and performance is to work on tasks that allow us to remain alert. And so if we are moving into a space where too much stress and too much pressures are making us achieve so much, accomplish so much, where we're starting to feel weary and we're moving and we are working past that weariness. Now we are experiencing fatigue, and all that energy that we're channeling is all towards efforts for the clients that we work with. And so the fatigue can lead to exhaustion. And so we know that when the physical part, when our physical wellness is starting to deplete, our mental wellness is also depleting. And so it can lead to anxiety, it can lead to irritability, it can lead to, eventually it can lead to a breakdown. What we want to do is like, you can look at the picture and like see how you find where your healthy point is for you. Because we don't all work exactly the same way, but certain levels of stress that helps us accomplish, but does not help us forget what we need in the process to balance out or to maintain those levels of performance. That's good for you to find that. It's when you supersede those, once you've identified, you supersede those, then that's when your red flags come up. So the potential course of impact, and I thought this was interesting enough to want to consider here. So there can be, it doesn't necessarily have to be linear, but there are a lot of times this is what some of the experts are speaking to. And so phase one is zealot. It's like, so just think, kind of like what I was mentioning before, many times when we think about how we thought we were in, we started out very enthusiastic about our career, or we are in a new job, we're in a new position, we're excited to, keep going forward and doing new things. So we're enthusiastic and we bring that energy, and sometimes we will actually bring the smiles, right? And so we are willing to be a team player. We're willing to learn. We're putting the extra energy so we can understand the different protocols, and we are putting forth some really good work and helping different clients. That's phase one. Phase two can be the irritability that we start to feel. So do we get to a point when we are passing that peak point for ourselves on that stress curve, and where we get to a point where we are superseding our own capacities, what's healthy for us? We are starting to forget about our own health. Like, for instance, if simple things like not taking lunch, not stepping away, putting in a 10 or 12 hour day when you really don't need to do more than 8, where the urgency is not anything on the part of any clients you're working with. The urgency is coming internally from you because you want to accomplish more. And then you start to notice, or somebody starts to notice or might mention to you how irritable or how short you may seem to be in your interactions with them. So you take shortcuts. You might not be around, people, you might avoid them. Conversations at work, you might participate very minimally. You might start to make errors. So these are things that can happen that you don't typically do. So that irritability factor can kind of translate so many different ways. Phase 3 is withdrawal. And you folks have picked out one of the symptoms of compassion fatigue, that isolation piece. Well, people sometimes, when you don't necessarily want to work with clients, maybe you're showing up because you have to show up because you can't find a reason to take off, or you can't find a way to not deal or not schedule clients for another day. Maybe the clients themselves, you feel like you're irritated at the idea that you have to sit with them for a while, or you will have some experience with them and you start to feel like you already bothered before you even meet with them. And that really impacts our ability to be present with them, be empathetic, to be supportive. And the other thing about that is that clients will you can actually pick up on that. You can see somebody's, not aura, but you can see in their facial expressions, in their mannerisms, and the words they use, whether or not they're present with you and being supportive, or they may be going through something. Sometimes you can actually pick up on that. So clients can do that with us as well. We do that. We tend to listen to more than just what the words, than the words that are being said for our different clients. The population can do that with us as well. So your enthusiasm kind of disappears and it gets noticed. So you're withdrawing, you're avoiding discussing your job. You might take off time. You may not be processing anything, but you may be very leery about being in the workplace. Then there's the experts have been saying how to identify another piece, phase 4, the zombie, going through the motions. Like your personality may genuinely typically be more light spirited and very congenial and maybe smiling. And so then, but you start to go through some different changes. You start to notice you're not having as much fun. You're not even as humorous as you used to be. Your emotions, you're not as connected, or even when you hear someone's situation, it's more of a logistical conversation that you're hearing as opposed to the empathetic ear that you should have. So the loss of compassion, thinking that it's hopeless, like it doesn't matter what you do, for anybody because they're still going to go back to doing the same things. I've heard that so many times, that desensitization and that desensitization that happens a lot of times, that zombie aspect. These can be potentially what happens with us. Let me see what's in the chat. Yeah. So that's interesting. If you don't know what a lunch break is, and I remember when I first got in the field, I had the executive director look at me and tell me, "You're doing great work, but you need to take your lunch." And I remember being told that. And after a while, as the longer I stayed in the field and before I came into research and training, and years later, and I started to look at data, and I started to realize how we're not always aware that our potential to want to be available for someone and keep up with the busy schedule can take away a lunch break, and how valuable a lunch break is. We think about lunch, we're like, okay, we're hungry, we feed, and we don't necessarily give ourselves more credit than that. There's actually a therapeutic opportunity when you to disconnect. So think about that. You're entitled to it. You're getting paid for that lunch break, whether it's 30 minutes, 45 minutes, or an hour. So some folks may be in different phases. You might recognize yourself in this. And you can be as productive, and I'm going to use your words, Christine, you could be a productive individual. The idea is, but when you see that you may be overdoing it, and I'm going to end, I'm just going to mention, you really need to think of yourself. In order for you to be available for folks, you have to be available for you. This is why I started the whole webinar with the most important factor to client care is you. You are. If you're not in a healthy place to be in position to support someone, then what does come out can be more harmful than good. Not just for yourself. I'm thinking for them. If they're that important, it's really your responsibility to take care of you. So think about that, the different opportunities that you do have. Let's not minimize that. You do have more opportunities than you may realize. And I know that the work drives us. And so when we think about that, we think about, what else is kind of taking place, some of the factors that the data has shown is sometimes we have our own vulnerabilities that we bring. Even though we are professionals, we have our own vulnerabilities. Do we have the ability to be empathetic? Do we have our own trauma history? So it might make us more it might affect us even more deeper if we are hearing some of this. Should we use certain activities, certain exercise, certain resources to be able to process our own, perhaps past experiences? Maybe we did resolve, but they have imprints. And so kind of think about that as a way of making sure we're healthy enough for ourselves, then we can be healthy for the other person. The caseload, and I don't want to confuse this with burnout, but the caseload, it's not so much that you have that many clients, it's that you have that many clients who are sharing with you all these life stressors. So let me just make sure I take it all the way to that point. So important for us to realize it's not just that, because I don't have the capacity or the authority to do anything but just respect the fact that I know most of you have a larger caseload than, not that you decide that you probably are supposed to have, but that's because we are so undermanned in the field. And it's also because you're really good at what you do. But it's not that you have that many patients, it's that there's that many people speaking to you. There's that many people who trust you and are sharing with you a lot of these things. And even if we have a way of consciously being able to try to process out, we don't necessarily understand how we are internalizing a lot of this unconsciously. That is so important for you to be able, even if it doesn't necessarily feel like anything is affecting you, like if you had 3 or 4 clients who had situations that were hugely impactful for them, take a step back and you look at yourself, and just acknowledge where you're at with that. So important to be able to see yourself in their process, because you're the supportive person, you're the ally, you are the one that's helping them, but you don't want to lose yourself in the process. So the truth is, there is so much here. There's so much here where it really requires, or encourage, let me just say that. It encourages us to kind of take our perspectives, how we tend to look at things and interpret our situations, and kind of tweak that a little bit. If we're not putting ourselves in that process, even you can still put the client first, but you have to put yourself in that equation. If we're not doing that, that's a red flag. Let's look at that and let's unpack that a little bit more. Any comments about anything that I've shared so far, other than what's in the chat? So I don't see anything right now. So what I'm going to ask you to do, and I didn't say this before, but how I typically do this, I typically give about 90 minutes, 90 minutes. In 90 minutes, I did say it before, but I didn't say it with the logistics. But let's take a 15-minute break and let's come back, okay? It's a 3-hour training. I really don't want to keep you here 3 hours sitting. So don't log off, just turn off your camera and then come back when you're ready. So appreciate that everybody's here and present and doing this. And so I'm just curious, any comments, any questions that's coming to mind? You're very active in the chat box, which is wonderful. Anything else that kind of comes to mind? Any suggestions that you want to add? Anything else? Okay. All right, thank you for that heads up. I'm getting little notes and I've been reading them, so I have it, even if I don't always respond, but I have it. Thank you. Okay, so let me go back to where we were at. Take it from the point from where we were at. Let's think of symptoms of compassion fatigue. And so some of the things can include, and compassion fatigue, again, just to kind of tap into something I mentioned before, it tends to, these are signs or symptoms or things within yourself that's not customary to how you typically are. So you're your best, you know yourself better than anyone else. And And these tend to last for a while. This tends to come up after some time, like there's a word that they use that some of my clients used to use when I was doing direct services. They used to say it rents space in their head. And so the same thing with any one of us. If something is spending so much time in our minds and it doesn't have any correlation with what we're doing, and it kind of gets in the way of us being able to focus on other things, that's part of it. You know, it can happen sometime after the fact, so to speak. And so the compassion fatigue has a way of slowly, maybe sometimes insidiously, changing how we perceive what our philosophies are with the world. If we were naturally optimistic people, we might start to seem not as optimistic. It doesn't necessarily mean that you jump to the other end of the spectrum and you're a pessimist, but I mean, it could, but it can also be that you're just not as hopeful as you have always known yourself to be. And so things like that. I want to think of the things I want to mention the things that are the most practical that we may have an easier time observing in ourselves. Self-awareness is essential here. And so compulsive behaviors. There are times when we overdo something that we don't typically do. Sure, we'll have that piece of chocolate once in a while, but we're having that piece of chocolate cake absolutely every day after the last very, very stressful weeks at work. Are we over sometimes, and we used to see this as a form of acting out, you know, with people we're trying to help, but sometimes when we overshop or when we overspend, when we over anything, when we go over the threshold of what we normally do, that's the idea here. Those compulsive behaviors can be symptomatic of compassion fatigue. Think about self-care. Sometimes maybe some of us didn't really think about self-care as those natural, you know, things that we do every day. I mean, actually getting 7 hours of sleep at night is healthy for people at certain age ranges, you know, between 35 and 55. That's really healthy. I know plenty of folks who say I can function really well at the top of my game with 4.5, 5 hours sleep. It's not so much that you can't, it's that that's not necessarily something you want to do all the time. Just like when those stress levels are really higher than they need to be, when we are activating our sympathetic nervous system. We have parasympathetic nervous system, sympathetic nervous system. The parasympathetic nervous system is what keeps everything. It's when our bodies and the functions are going properly and everything is at healthy level and you're not being stressed, you're more in the calm space. And so a sympathetic nervous system, when that gets activated, you're in a high stress. You might be, rushing to being on time at the bus or to get the subway, to be at your appointment on time or to be at your work on time, or you are getting in your car earlier so you can beat the traffic. Those kinds of stress levels can be healthy when it's too high and consistently high. The sympathetic nervous system is not biologically designed for us to be in that very high level stress mode consistently every single day. And so that's not healthy. And we end up starting to do too much of things, more than what we usually do. If we're not even, so some of the most simpler things is our hygiene, our appearance, our way of speaking, are we interacting, are we more short? Some of the things may be indicative of poor self-care. So I want you to consider a couple of things. Some signs that might be very observable also include so apathy, which is part of how you got that question correct, is it can be hard, to hear, a stories or something, a challenge or a situation from an individual. And then sometimes we can actually, as providers, we may be limited. It may be a situation where we don't have a lot of resources to support, and we might feel somewhat powerless or somewhat uncomfortable or not in position to be able to be the best support for an individual. You find yourself feeling like someone is sharing certain things and you have resources available, but you're just not seeing the connection to what you can do. That apathetic feeling of that toward a person that that a person, a client that where you're one of the things that you start to feel is like just more exasperated at hearing the story and more speaking to your weariness and your lack of ability to be actually present. Like you just can't move forward, like you can't do it anymore. And so that can be apathy can look in so many different ways. That's just one way where I'm saying to you. Another sign of compassion fatigue is when you're angry. So how many of us are familiar with the HALT sign? Now that came, so you folks, who's remember, thumbs up, thumbs down. Who knows what HALT stands for? Yeah, very good. Okay. So that is hungry, angry, lonely, or tired. That comes from the recovery culture. And so, and the idea is that if you can identify where you're at that some of these components may be part of the reason why you may be at a very high stress place. It may be part of why you may be feeling maybe angry towards someone. So someone just had the hand up. Was that Jessica? Was that, who's that? Who is that?
Wasn't me.
Okay, so hungry, angry, lonely, or tired. A lot of times when an individual is just doing too much or exasperated or super weary and continues to go on anywhere or they see themselves, they're being very short with the other individual, they're not patient, they want them to hurry up, to finish saying what they're saying. And so they can kind of move it along and kind of sometimes nip a conversation, or particular, counseling session. And so the hungry, angry, lonely, and tired are just indicators that we've learned from the recovery field, and a lot of therapists actually use in their sessions, where they help individuals identify that if you're too hungry, you are more likely to be short or angry or irritable. That if you are angry, there is something maybe unresolved, something going on. Maybe there's, maybe you're hearing too much. And you haven't processed a lot of the information that you've absorbed from your clients, say, in the last week. If you're lonely, if that is going to a point where your own personal life seems to be you're disconnected from people, you're more in isolation mode, and tired, weariness, weariness. And we know that, working beyond your capacity is part of one of the symptoms for compassion fatigue. So that's not a bad acronym to kind of keep mindful of, to just so you can look at yourself and say, what am I? If you just notice that you were abrupt with a client, that's not what you usually do. When you walk away from a counseling session, many times these situations kind of tend to norm, really bother us, it kind of stay with us. So take a step back and say, well, let me see, well, what's going on with me? It's not necessarily someone else. It's what's going on with me. How did I interpret that? Why am I bothered? Because I'm the one carrying the feelings. I'm carrying the uncomfortability. Am I hungry, angry, lonely, or tired? Could be a really good, quick self-check reference. So when you're angry at persons who are actually clients who are actually having different abuse issues or are experiencing substance use disorder, and when we get frustrated or angry at them for their situation, that's certainly there's something not appropriate about that. Folks, kind of, when you understand the dynamics of why people do have substance use disorders and other issues that are impacting their world, the fact that we get angry at them, we're not, that's an issue with us. The feelings are coming from us. Isolation, you're avoiding people, you're minimizing, how you interact with your colleagues, and you start to see that even with normal activities that you generally engage in your personal life, and you start to diminish or disengage in that. You're more that pessimist. Remember, I was talking about being an optimist and a pessimist. And so when you are more of a pessimist than you are an optimist, and optimism is kind of part of who you are, that can be an indication, that you are experiencing compassion fatigue. And so, because a lot of times with with the empathy, you also bring hope for a lot of the people that you serve. So that that atmosphere that you help create, where a person can be supported and help them feel hopeful, gets transmitted by us. And so if we're not feeling that, if we're feeling like no matter what we're going to do with this person, it's not going to go anywhere, and then you're doing that pretty regularly, and that's not normal, that's not your usual way of thinking, that is a huge indicator If you're becoming more of a pessimist, your attitudes are changing. That can be a sign of compassion fatigue. You know, there can be a significant change in your normal, what behavior was normal to you. And so you want to be able to, like, your awareness, it's the very thing that's going to pick up on that. Then you're able to look at it and understand or decide for yourself, is that an issue? Is that an isolated incident? Is that part of a pattern with yourself? Fatigue is it's very strange. This is like a unusual, not an unusual one, because you are expected to feel tired and weary behind all that energy, driving activities that you engage in on a daily basis, while after you hear and support individuals in different places in their own recovery wellness process. But the fact that you're tired is not the issue. You're tired, you go home, you get some rest, and you should feel somewhat more rested. But if you're tired all the time, every time, anytime, you know, if you're tired all the time, that's a huge concern. This is a huge red flag. And it doesn't mean that you're not, and it doesn't mean that you're eating differently. It's, but if that is impacting you physically, it's going to be impacting you mentally. I don't know a time where we don't typically feel tired, but the exhaustion as the consequence. And there's such a thing as actually medically diagnosable exhaustion, not just the tiredness that we feel after, say, a 10-hour day, or we had to cover for somebody, or there was an emergency, or there was an audit in our agency. I'm speaking to when exhaustion where to the point that you've gotten yourself to the point that you're so weary physically. This doesn't matter. This is not an age thing, but you're so weary physically that you can barely move without a lot of pain. That means you've achieved an extreme to that weariness, where working past the tiredness, where not balancing that out and not compensating with enough restful time has become an issue. You've done it all over again. You've gotten to that place. So there's such a thing as that, and that hurts. That's very painful. And so these are signs that can be indicators of you experiencing compassion fatigue. So I want to have another case scenario. Can I get a volunteer, please?
I'll read it.
Sure.
Case scenario. He was counseling a client who survived an overdose and counseling other clients challenged with life stressors and substance use disorders. It got to the point where he could not manage his own negative thoughts or feelings and fears about the future. He often thought how useless his efforts seemed to be with his clients. After a month of steady decline, John finally reached out for help. He was diagnosed with clinical depression. He told his counselor, "I went beyond the breaking point. My client's depression became my depression. Their symptoms became my symptoms. My worries became just like their worries."
Thank you so much for reading. I appreciate that. So what are your folks' comments? What do you say? What do you take away from this? What are your thoughts?
This is Sylvia. This individual was not able to separate his job as a professional from that of the client. So he started to be just like the client. So he carried on the same feelings and how they were behaving. So that impacted his ability to be able to help these individuals.
Mm-hmm. Is there anything more that you see? That's a really, really good assessment. What else do you see? Because what you're speaking to is transference, which is great. What else? Do you see anything else? Does anybody else see more? Thank you so much, Sylvia. Jeanette.
I feel like he waited a little bit too long to recognize what was going on with himself and to get the self-care that he needed so that he didn't reach that rock bottom.
Okay. Do you know what's interesting? When we're learning to be more self-aware and not just person-centered, it can, you know, it's a different time frame for anyone and everyone. And it kind of depends, it can depend on the situation. Can it have been prevented? Well, that's part of the reason why we're doing this compassion fatigue type of webinar, is to increase our awareness so we can understand how we can see ourselves coming, so to speak, as opposed to learning from hindsight. if he's kind of new in the field and doing this, well, maybe now going forward, he might be able to, recognize those signs sooner. So I totally understand what you're saying. At the same time, though, so some people did say this, though. They also noticed some other things. So thanks, Jeanette. Athena, what did you want to add?
I wanted to add that it sounded like it sounds like I have a problem with this with some of my younger coworkers as well, is that real supervision is needed, I think. And I feel bad for this guy because nobody else in the office picked up on it.
Yeah, yes. And I have something on that. It's true. Because sometimes we are each other's kind of barometers, and we can help each other see what we don't end up. I can help see something as someone who they may not be in the moment to be able to see for themselves. So thank you for that. Roosevelt?
Seems like he had some guilt and felt like his efforts weren't being productive when he says he's felt useless in his efforts to see his clients. So he was self-doubting a lot of his purpose as well.
Yeah. I think so. But in order to do that, would you mind if I add to that he's probably becoming aware, he's starting to see certain things in himself?
Yes.
Yeah. So thank you, Roosevelt. It's so interesting when a person is so driven to help, like everybody here on this platform is so driven to do the work they do. And you're so engaged, you're so focused. And then you get into these routines and you're conditioned to doing certain things in certain ways where you accomplish a lot. And then you don't necessarily see yourself, but you've gotten comfortable with this routine and you accomplish what you do and you know how to work and navigate and do things to achieve the supports you have to give individuals and to actually meet the requirements that you have in your responsibilities as the provider and in your capacity. This individual, as John was looking, where he could not manage his own negative thoughts or feelings, it sounded to me like he attempted to try to be more channeling of his energy. He was trying to work it until he noticed he couldn't. The fact that he went to his counselor and he shared the insight he had into himself is huge. Because sometimes we have to go through certain experiences to understand, oh, this is what happened, and this is as I was going along, and this is where I went to my breaking point. Those are all reference points that that person and you guys can use going forward as you deal with different situations. You have those opportunities because you get to know yourself at a level that you're not necessarily accustomed to looking at. Most of us are working from what this society and what our world, requires for us to do. And not often do we look at ourselves because in a literal sense, if we look at ourselves, we're not necessarily being person-centered. But when we think about it from another perspective, when we are trying to be available for the other individual, and we're still being aware of our own feelings, we're keeping ourselves involved. That's a really good thing when we can pick up on it. And so going forward, this individual may learn to do different. Separating feelings from their feelings. Anna, thank you for saying that. Would you like to elaborate some more on that?
Yes, it's about if you don't care about yourself because you don't know about that happened to you, maybe you don't aware about the problem do you have. Maybe we need to work together and say, hey, I saw something different in your behavior, or you be aware every day what happened with your behavior and with the coworker. But it's hard in this job because it's a lot of emotional things happen in your life and then their life. So it's hard to handle. And I think the best way to handle is to have a day off to take care of ourselves.
I think taking a day off is great. I wish this country was into 4-day work days. I think that would make a difference. The idea is what you're speaking to, their awareness, Anna, and I appreciate that. I also looked at, I see you, Desiree. I also looked at Jesus's response, kind of speaking to very similarly to what you were saying. We are so good at looking at our clients doing this, you know, like when their behavior changes, why are we so challenged looking ourselves? Desiree? Desiree, I'm sorry.
Desiree, that's fine.
Okay. Good.
So what I'm working on with myself is to learn not to take things personal, because oftentimes we associate our level of success through our client's success. So when, like, I work with the DV population and I also work with the homeless population, and sometimes we rooting for them to do so well, but then they fall back into whatever brought them to us in the first place. And we think of all the things that we did to help them, and then it didn't work out. So we put that on ourselves. So when we talk about, you know, in that one article that we just put up, that posting, he's thinking about his efforts was useless. That's because we measure our success against the success of our participants, our clients.
Thank you, Desiree. Desiree, is that right?
Desiree.
Desiree, thank you. Thank you. That's nice. It's really a nice assessment. Simone.
One final thought I was having
Sure.
was that one of the things I struggle with is, you know, as I work with clients, you get triggered maybe in ways that you've suffered in the past. And sometimes I come from a place of wanting to be what I would have needed in the past, and find myself getting too caught up and too attached to that person because of that, because I see in them so much of myself.
And that's an interesting point. And I wonder how that can also lead to wanting to provide the same supports that worked for ourselves for that person, as opposed to providing support that specific and tailored to them.
Yes.
Yeah. Thank you, Simone. Okay. So, you know, it's just interesting how this individual ended up even getting to the point where he actually went for help, and then he got the diagnosis of clinical depression. That is interesting to have gotten to that point, being driven to go forward, to always be present for that individual, making sure they're being responsible, taking care, and maybe you're supervising other folks and other peers, and there's a whole lot that you are involved in that comes under your set of responsibilities, along with everything that you're hearing and trying to be available. And to be able, and I like what Jeanette mentioned about, well, he noticed a little late, because he had not, at that point, he had met the criteria of clinical depression. But I think for everyone, the process is individual. I think at least when you do notice, when you do find out where you're at, hopefully you're helping yourself. But when you find out where you're at, you can use that. You can use that going forward. So at this point, I want to ask you all, you have that piece of paper. And my third question would be is, what is the most stressful part of your job? And write that down. And take a few seconds for that. As much as I would love for ATTCs to say, I mean, not everybody has someone who's saying, listen, you should take that lunch break. Or listen, you have mental health issues, you should do that. A lot of times we also have the experience that, hey, I know you got too many people on your caseload, but here's another person. I mean, you know, it's like very contradictory a lot of times, and different people have different professionals have different responsibilities. So it's really up to you. It's really up to you to raise your awareness, understand, get insightful about yourself in different situations, and learn what you can do for you. And so one of the first things is to identify what are the issues. And so we identify what compassion fatigue is and how it can be symptomatic. And hopefully we're relating it to ourselves. And so that's why I asked you that the third question, I asked you at first, at work, what is it that you're good at? Then what your favorite part of the job is. And because those two tend to be, they tend to intersect, and they tend to be what we put the most energy in, you know, or we get tagged on doing certain things because we do that so well. And so now it's like, what's the most stressful part of your job? probably not one part. And yet I'm asking you just to mention one. The thing is, the more, if you're able to identify certain aspects, like the way the questions are asking you to respond to, then it brings you closer to a solution that is personal, very intimate, very tailored for you. And so I want you to look at this kind of quick scenario here, and it's kind of like just a quick reference. And so compassion fatigue, the process, and a lot of the research speaks to this. I should have put cited the source there. So, you know, the empathetic ability is what we attempt to bring to any new client. And typically this is what we bring to our work. Let's just say ideally, this is what we do. So exposure to suffering is part of what we have. So we have a response to that. It includes our concern, and it includes how we correlate and access resources and connect the individual to those needed resources. After time, what can happen, the empathetic response can start to deplete. And what you start to see is things like the detachment, or the hopefulness is kind of lessened in less than what you typically reflect. The sense of satisfaction at your job that you used to love so much, now it's more of a chore than it is a joy. You know, and most people who work in the field, in the people field, tend to be in the field because they love to work with individuals. And so when that starts to lose its romanticism, its sense of hope, and your sense of satisfaction for you shouldn't minimize that. Let's look at that. And so why are we feeling like that now? You know, because even if we're not conscious of it, cannot be a sign saying of an unhealthy place, or a place that we're at that we can do something, that we need to provide some health or some wellness for ourselves. So what it ends up resulting is residual compassion stress. And that over time, without any interventions, without any means of mitigation, you know, that prolonged exposure, it can lead to compassion fatigue. When we have those situations that kind of just stay in our minds, you know, that with pressures of other responsibilities in your life can all lead to compassion fatigue. Compassion itself doesn't lead to fatigue, but just the absorbing of all of that and not being able to balance yourself out with what you're hearing can lead to compassion fatigue. And so this was mentioned before, so I was really glad that it was, because sometimes since we don't see in ourselves certain things, that someone else can pick up on it. First of all, presentation is key, but if you believe a coworker might be experiencing some negative reactions to compassion fatigue, think about reaching out and talking to them individually. Just take them to the side. Listen, I happen, you know, you got a minute, you know, especially, and make sure that you're a person that is able to have a conversation with this individual. If everybody does not have to be best friends, but if you can have nice, you know, have conversations that you're comfortable with an individual, maybe you want to kind of bring something to light and ask about it. And asking in a question form is probably the less intrusive and non-judgmental way where the recipient may be likely to be more responsive. Helping other folks establish a consistent work-to-home transition that creates an important boundary and safe place outside the workplace. This kind of falls, and to me, I see this falling under clinical supervision. This is so important for supervisors to be mindful, to understand the dynamics that are impacting the individual, because their professional development is one part, but their professional wellness is also part of the responsibility to a certain extent of the organization. So being able to help the individual, you know, understand and kind of decipher, you know, are they doing more work than they are even participating in their own lives. Encouraging them to do the basics, take your lunch hour, sleep healthy amount of hours. 7 hours is typically the average healthy amount of hours. If you've been functioning on 5 hours sleep for the last 20 years, you might want to give yourself a chance and do 7 hours for like at least 3 days in a row and see the difference. Just see the difference in yourself. And if it doesn't work, don't do it, but you should try it. Because you may find what the literature talks about, the research literature talks about, in terms of how much more restful, not just the body is, but the mind seems to be even more alert. Supporting connections with families and friends, referring them to organizational support such as peer support team. The EAP programs are available, but many people, have, if your personal philosophies include, some spiritual belief systems, you can tap into those resources. Other peer support team is really important. The idea here is for you to be able to tap into a source if you start to be aware of some uncomfortability, even if you can't necessarily pinpoint it, because you want to be in position to be as objective and as sympathetic and as supportive as you can be for every person. And so you deplete those resources for those other folks. So it's really important that you take care of you. So encouraging them to discuss their experience with a supervisor. So here's I think is a really nice tool. And I know we're so overwhelmed that even the idea of taking a long time, like I love the idea of taking a mental health day, but I know most of us, and I know a lot of us have them, or we have vacation days, or we have personal days. But if we take them, we don't feel right because somebody else has to cover for our clients, so it's, or we might feel like, no, there's too much work to take time off. But you know what? How about something simple and effective? This protocol, this professional quality of life, compassion, satisfaction, and fatigue version, is only 5 questions. It's not for anybody but yourself. And this is just one quick way for you to think about, to consider the questions and see if this indicates that you're possibly in a place where you're going towards compassion fatigue or you're getting away from the compassion satisfaction. It's a kind of scale, 5 questions that kind of scales you and tries to measure where you're at. With some of the things that you might want to do, you want to self-assess this. So you can ask questions like, if you normally have a good memory, let's just say that you normally have a good memory, but lately you're having a problem remembering things, or you're missing certain details of certain things that you would normally, just have no problem remembering. You can be overstressed, and that could be a symptom of compassion fatigue. If you're in good spirits most times, but lately you find yourself irritable, short-tempered, as we said, that's another way of self-assess. Might be a symptom of compassion fatigue, especially if you think about what you're consistently doing with clients and listening to them. What about some logistical things? So like usually you have a certain routine, you're pretty neat in your office, you're very well coordinated, how you do things, you have things scheduled, and you find that you're not doing those things. Sometimes you're dropping some of those responsibilities, and that might be a sign of compassion fatigue. So think about those things that you are normally or customarily involved in, that is part of you, when you are in a healthy place as a professional, in personal life, and available and responsive to the clients that you're working with, and how you may be deviating. Like compare not today to yesterday, but maybe a good way to compare might be able to look at where you're at today, look at where you were last week, look at where you were a month before, where you were 6 months before. Have reference points. Those can be helpful for simple self-assessment. That is so important to be able to do once in a while. That's self-check-in. This is a 5-question tool that is so easy, because reading too much is overwhelming for a lot of us. Nobody has time to read a lot. A lot of times you'll read the first 2 lines of an email and you leave the rest. And so if you do that, I'm not saying, but if you do that, so that tells you, okay, you're probably not, you don't have time to read. It might be part of how you generally function. And so maybe these 5 questions can be helpful for you. There's other ways to this, there's another version of the same thing where it asks you questions. It's really simple, like, and you can, it has an interpretation. It's more about these questions about what you experience, both positive and negative, and you consider the answers and you score yourself. And the thing is, how frequently you experience this within the last 30 days can be indicative of where you may be at some given point. So this will be on the slides when we send them. So the whole idea is about understanding how we can achieve a work-life balance. So making a bigger impact at work and in the world, but without losing yourself, without sacrificing your happiness for it. And so think of our psychology. Part of our psychology is that if in our minds, there's so much we're absorbing, mind you, on a conscious level, I've even touched the unconscious level. But so much we're absorbing on a conscious level, then think about what we can consciously do to offset that. We are as human beings, well, we know that a lot of our clients go through so many different challenges, some more than others, but so are we. You're the professional, you bring your expertise, but you also bring your humanness. So if you are not participating in things that you normally do, I'm talking about just the weekdays, not just the weekends, but even during the weekdays, what you normally do, and you're no longer doing it because you are just in your mind because of the different stresses your clients are going through, that's what you want to mitigate. So you want to make a bigger impact at work and in the world, but not lose yourself in that process. Having a positive impact on your kids' lives, having a positive impact on different family members. It depends how the format of what your family looks like. Being present in the moment. So when we think about mindfulness, and I have a slide on that, when we think about mindfulness, it's not always just meditation, meditation for a whole 30 minutes. Mindfulness is just a moment, is the ability to be able to stop for a second and just recognize in the moment where you're at, to bring you back to where you need to be. And sometimes when in our minds we get distracted, even when we're listening to someone, because we're no longer able to be totally present for them, that's a good skill to have. Priority what's important to you. So we talked about self-care. So you folks, I mentioned it, we're going to go to it in depth, but self-care is where you can do things because for yourself, because not and not feel guilty about it, because you need to, because you are it's not so much that you're deserving as you're a human being just like everyone else. You need to take care of yourself as well. I tell people something that I know is, it may sound a little funny, but it's really true. It is your ethical responsibility to take care of yourself. If you're in the field of taking care of other people, you have to take care of yourself first. So that way you can put them and to use person-centered care to help them. If you're not in a position to be objective, empathetic, responsive, for individuals who need that, then you're not the person to help them. So you have to do this for yourself. So work-life balance includes that. So have strong boundaries in terms of what feels good and what you would do, what you engage in. And give yourself permission not to apologize for being human, just like the next person. So letting go of trying to do it all, especially for not just high achievers. I think anybody with a job, especially in behavioral health, tends to do that, and we don't know how to not feel bad about it. And so here is the idea: give yourself permission to do so. By doing so, you are in a better position to help others. So some ways to kind of master that, some ways, is prioritize your own list of a daily must do. Like a list specific, inviolable work hour boundaries, certain things that absolutely no reason you would step off. You would not, you stay at work longer. You want to give yourself, like, if this is a 9 to 5 job, most of us have been taught that you're supposed to leave the job, the work at the job. Well, that's not the easiest thing to do. But you want to be able to try to practice that. If you have certain days that you have to stay later, that's fine. But if you have other days that you have certain time frames, keep that, put the boundaries on for yourself, because you have a life as well. One of the things that is wonderful to do is to be able to help someone else, but you're practicing what you preach. By helping yourself, you're helping someone else too, because by helping yourself, you're putting yourself in a position to be that ally for that individual. So you're actually helping them when you help yourself. So the priorities task is, what's important to you? What is that you need to do? What is it that speaks to your spirit, to who you are, to what's important to you? And do that within the boundaries. You have a personal life and you have a work life. And that's great. But you can't carry your work life into your personal life, because then it's over. And so some of the ways to master that is, what's your to-do list? What does that look like? Reevaluate what that is. If you've done it in the past and you got pretty okay with it, go back and think about that. Like, for instance, that would be the fourth question, is like, what is one thing you could add and maintain as a regular routine every week? What would you do that you won't compromise? Whether it's keeping your lunch hour, whether it's just taking 15 minutes away, every couple of hours from work. What is your to-do list? Your to-do list should include something like that. Automate and delegate to streamline client engagement and save precious hours. So what that is speaking to is, are there certain times where you can do certain things? So for instance, there was, I was in an agency one time, and I had clients who would come in. I would have already scheduled client counseling sessions. I would have other times where I had to do staffing. There was, of course, 100 different phone calls and a lot of, progress notes to submit. And it was very difficult when I had clients constantly in crisis, coming in all times of the day, and would impact on whether or not I can meet fully for another client. And it became really, it became so stressful. So one of the things that the agency was able to do is to put in a protocol, and they said, if there's any, and they told all the clients, this was to help us. They told all the clients, when there's a crisis and you don't have a scheduled appointment, you will have between the hours of 4 and 5 to come in and share with your counselor, what that situation is, so we can help to support, mitigate and support. And so that actually cut down all those crises that were happening at different hours, and folks were coming in for crisis intervention at that time. And that further helped me and my colleagues to be able to balance out a little bit more, where I wouldn't have to hear between two stressful situations of scheduled appointments. I didn't have to also have the extra impact as someone who isn't fear-based and in crisis mode, and then I have to absorb that too, so I can better support them. And so that was just something that the organization that I just thought it was really great. Embrace the power of no when you're stretched thin. Actually be able to say, listen, I can't. I have this many people. In order to be as responsive to them as I need to be, I can't take on another person, and I won't be able to be there completely for them. Can we find another way? Connect with your support system regularly. Don't hesitate to seek professional help. Sometimes we don't have clinical supervision that is available at our work. Well, what's another resource that we can go to? Many of us have colleagues and associates that work in other agencies, and perhaps, sometimes being able to talk shop with someone, to debrief, to come off the day, to be able to kind of process through some of these work-related, intense, feelings where you're starting to feel like hopeless and like you can't feel like you're useful anymore to your client base. That can be helpful to have that resource available, even if it's not necessarily available at your job. Maintaining a journal. We know journal can be healing, and it's a great way of kind of taking the intensity and the weight that comes with the pressures that we keep in our minds. When we write it down, what can happen is it's using the phrase that I mentioned before, it rents less space in our minds. It's a great way to diffuse, particularly when it's around, so we have sometimes clients who share with us situations that are extremely, extremely hard to listen to. We hear how they have survived some of their situations, how they may still be involved in their situation, surviving day to day, and we hear it and we feel it. And sometimes that can be so impacting on us. So it's important to be able to at least write it, can let it out some kind of way. So integrate self-care into your daily routine, even for a few minutes. So that lunch period, walking around, some people are doing meditation. Some agencies actually do give meditation opportunities, even virtually. Sometimes you can actually, research online where you can get meditative, a guided meditation for like 10 minutes. It's easy. You can just Google that. I truly believe in meditation to start off the day, but there are times you can tap into it any time of day. Take a walk, just detach, physically detach, and the mind will follow. And so that way you can unwind a little bit from your stressors. So susceptibility and resiliency is kind of speaking to some of the same points, whereas, connection is really key. It's going to counteract the isolation piece when we want to prevent and stay away from people because we're irritable. And so that can be, because that can be symptomatic of compassion fatigue, keeping that support available to us. Getting involved in the community. The sleep, I can't tell you how important that sleep is. So when you have healthy sleeping patterns, you are in a better position to make healthier eating um, eating choices for you. So it's kind of hard to stay energetic when you haven't slept enough, when the foods you're eating, say at lunchtime, when you are eating, the foods are very heavy, are more likely to kind of not keep you alert, but maybe make you want to go to sleep. Understanding what kind of foods you eat is also another part of it. Doing exercise, any kind of physical activity. It doesn't mean that you need to have a year membership at a gym. It could just simply be that you can get up and walk around the area. It could just be that you can stretch. Stretching is energizing. So simple things that we don't tend to think about can be so helpful. And always stay hydrated. So participating in trainings to help strengthen resilience. We learn to recognize the signs of mental health distress, kind of like what we're doing here, huh? And how you folks are helping each other. I love these conversations you're putting there for each other. Most of us don't get paid enough to eat healthy. Oh, goodness. I'm hoping that you have enough to go get an apple somewhere. So some relaxation practices include progressive muscle relaxation. Many times when we are so high stress and or when we are so high stress, we feel it physically. And so mindfulness, meditation, breathing exercises, yoga, tai chi, qigong, these are all different types of approaches can help us kind of regulate our biological system, kind of bring us to, the parasympathetic system to kind of a level of homeostasis. Certain, chanting, sometimes some folks have actually had experience with this. Yes, praying also works. Just find certain activities that can be therapeutic and bring your mental and your physical state into a calm space. So here is something on mindfulness. And so it talks about how the meditation, the results can be, the control of your attention. It's easier to focus. Emotional regulation is a sign that meditation, that mindfulness is working. And it's not just a meditation, just being able, and one thing that I said earlier is, even if you're not exactly going through a traditional meditation session for yourself, just the ability to be able to stop and just refocus and acknowledge, specifically acknowledge where you're at in that moment. And so it can be a way to lead into emotional irregulation. Because when you're irritable and when you're short with folks, that's more reactive, and emotional regulation is really speaking to responsive. Yeah. And so self-awareness is key. I think that should have been first. And the more you are aware, the better you know, the more insightful you are about your current state. You're the one who knows whether you are, say, behaving in a manner and thinking in a manner that's customary. And so if you know certain things that you can do to help you get back into the moment, that self-awareness is key. All of that leads to self-regulation. So, and I think some of you folks have heard this, especially because what works sometimes with folks around, getting back in the moment can be something as simple as saying, so, just a box breathing where, you sit comfortable in a chair, just inhale for 4 seconds, exhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and then just and then do it again. So what that does is, and for my trauma experienced clients, that used to help them when thoughts would kind of activate the physical reactions, and would count. When you can calm the physical, you're more likely to be able to be more calm in your mind. So I wanted to read this to you. Rachel Naomi Redmond actually said this. The expectation that we can be immersed in suffering and loss daily and not be touched by it is unrealistic. Not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. It does come with the territory. It is part of the job. But just because we know it's part of the territory, it's part of the job, doesn't mean it stops there. It's part of the job. So when it happens, we learn what to do with it, what works for us. It's so important to be able to understand that, because that is what helps elevate your capacity to be there for other folks. So one last thing. And so I know, and if you wanted to touch on what I've asked you to put down on the paper. The reason I asked you to do that is I kind of wanted you to go through a journey to understand, you know, that you're very good at what you do, to understand that your work can be stressful, but there's certain things you can do. And so that's going to lead to this activity. So I want everybody to just consider, think of a time like when you had felt a sense of meaning in your work, a sense of meaning or an experience or situation, whether it was a colleague or client, and you felt a sense of self-satisfaction, some kind of meaning or purpose within that situation. Think about who it is that you were serving, and then think about the impact that you had with that individual. Think about all that now, and let's see if I can think of a situation. Okay, I know a situation. So I'm thinking of a situation myself. And I remember a certain client who had left an imprint on me. And it was great because she felt like I helped her in some kind of way. And it was one of my first experiences in the field. And how rewarding that felt. And so hopefully we can all consider that. You should be able to consider many instances of that. So when you think about what you felt and you have a sense of meaning, who you were serving, what impact did you have, see if you could fill in the blanks here. I exist to, in order to serve. So for me, it was, I exist to help women, especially those impacted by intimate partner violence. And because I had, in my past career, I did a lot of work with women about that. And I remember I was helped one lady consider some options, and she she just ended up being in a better place eventually, because it took some time. So that's my idea of filling that in. How would you fill that in? Helping a patient obtain a referral from a mental health provider. That can be rewarded. Okay, what else? What else? Now what I want you to do is consider one more thing. Helping a client get to work and move out of homelessness. Imagine that. That is amazing. So does anybody want to share? Okay, let me just take it off here. Think about positive moments right here. Think about what is it that makes you feel a sense of purpose in the work that you're doing? What type of situation? What kind of stands out for you? Where you know you played a part? Athena.
I've noticed that when I get a client when I can see them physically relax when they're speaking with me in our sessions, that is one of the most rewarding things when I start to build that rapport, and I can physically see their shoulders down and their tension in my presence.
Fantastic. That's absolutely fantastic. Thank you, Athena. Jesus or Jesus? I'm not sure how to pronounce.
That's fine. Hi, everyone. So for me, it's all about the outreach. Just recently, in fact, my team went out to do some outreach out in the community here in the Bronx, and we reached out to several homeless people in that area. And you know, we never know what we're going to get when we go out there. We try to meet them where they're at, just try to provide resources, wound care kits, anything we can to try and make their existence out there a little bit better. So we came back to the center, and about an hour later, two of the participants that we interacted with showed up at the center. And I remember them being so hesitant and so nervous and thinking that, what can we possibly do for them? And by the end of it, not only have we registered them in for services at the center, but we registered them for a special grant. We were able to give them like a $10 Subway sandwich gift card. We were able to give them a warm meal. They sat in for one of the groups. And while they came in very hesitant and scared, they walked out with a sense of hope and a sense of that we really can help. And seeing us out there where they're at, and then coming into our world and showing them that they're safe here and that we mean what we say. That to me is the greatest gift that we can give our community.
That's so all inspiring. That's great. Thank you. You didn't tell me, is this Jesus or Jesus?
It's Jesus for the sake of argument.
Okay. No, we're not arguing. I just want to be respectful. Okay. Okay, thank you. That was really great. I love this. So connecting with somebody who doesn't typically connect with us, outreach into the community and actually seeing them come in. Amazing. Rebecca, what's your moment?
I had one pretty recently. I work for a housing authority, and so it was a tenant who her husband had recently killed himself, and her daughters were also kind of dealing with the mental stress of that as well because they were teenagers. And so I got to go and I do the inspections of the units, and there were fail items, and she was very calm about it and understood they had to pass before we could move her in. So I went to the landlord with her, and they were like, you know, it was right before Thanksgiving, and they were like, I don't know if we can get it done. And I was like, let's get this done. So kind of being an advocate for tenants is one of my favorite things, where I can like be that in between tenants and landlords, when landlords just kind of want to be like, whatever, like I'm kind of like, no, this needs to be done as soon as possible so we can get them in for the holidays and for their own mental health.
Nice. Thank you, Rebecca. That sounds great. Chelsea.
Hi. I think one of my big things right now is that I'm working with, so I'm a sexual assault advocate for a nonprofit, and I'm working with a girl who, it was pretty bad, and she's getting ready to testify in court, and she's very, very nervous. And so we've been working over the last 6 months of bringing down her anxiety, like ways to process panic attacks and all that kind of stuff. So then that way, when she does have to testify, that she'll be able to do that. And we started off really small by having, you know, just like his name on the wall in my office. And we've worked all the way up to having like his face on a picture in my office. So then that way she's getting comfortable with the fact that he's going to be in court and she doesn't get all panicky. And just working with her through all of those panic attacks and anxiety and all that kind of stuff, just preparing her for court, watching her put in the work has been absolutely amazing. And to see her overcome so many obstacles in the last like 2 years to get to the point where she's at. And she met with me last week and she's like, I'm going to do this and I'm going to put him in jail and he's never going to hurt anybody else. And just kind of her sassiness when she came in really shy and quiet and withdrawn, to see her just develop into such a beautiful young woman is absolutely one of the most amazing things I can do.
That's amazingly courageous. Wow. How much trust she has with you and how it's working for her, how you're empowering her. Excellent. Thank you, Chelsea. Jeanette?
I work with homeless veterans, and to reach out to veterans is very tough. You have to really engage with them in a manner that they can trust you, and they really are standoffish, especially when it comes to working with the county and working in combination with the federal government. So I was working with the veteran that was homeless for a long time. And to gain his trust, you have to show them more so just talk the talk. You got to walk the walk with them, and you have to be upfront with them. So to help him, I helped him with the paperwork to help him. He was the only 10% disabled veteran. And I had to be blunt. I'm like, oh God, this is no money for you. And he wanted to get out of my car because I was just scolding him like, no, we got to work this together. We're a team. And so I helped him with the paperwork, helped him get into a shelter, helped him get into a hotel so he wouldn't have to sleep with other people. And I helped him get a VASH voucher, helped him find him an apartment. This was a new building. And he was so amazed. He was like, Janetta, you did it. Woman, what did you do? I said, no, we did this. We did this And when he got his keys, he was like, when he got approved, because he kept saying negative stuff, I was like, no, we got to get this negativity out of your vocabulary. We don't do negativity. So when he received his 80% disabled, he was like, oh my God, Jeanette, I just got approved. Oh my God, woman, you are bad. And he was like telling everyone about me. And he is in his new apartment, and he calls me every day and just say, Janetta, I am so thankful. I'm like, no, you are the one. You fought for this country and you deserve this. And so I just let people, and he let other people know, other veterans, do what she says and it works. And the government, yes, we deserve this. And yes, do what she says. And she will not lie to you, but you have to be honest with her, and the process works. So yes, and that's how it works. And he went from being homeless to being in his own new apartment. The building was only up for a month. It's a brand new building, and he is happy. So yeah, working with veterans, you have to be upfront and just let them know that you're here for them, and just let them know that the process works, but they've been turned down so many times, and you just have to regain their trust and be upfront.
So I'm gonna take all that amazing strengths that you just shared with them and just bring it back to you. It's great what you did for them. I'm thinking about your moment for you. It must be amazing that you were in position to be able to help someone through that process and through that point, you know, so props to you. Thank you, Janetta. Jessica. And you're the last one I'm going to take before I finish off. Jessica?
Yeah, I had a client, also one of the first ones in this role I have. I work for the state of Vermont, really, with Medicaid as a registered nurse case manager, but it's community-based. So lots of coaching, motivational interviewing, education, that sort of thing. I had a client that was referred to me. She was 31 and 500 pounds. She had 2 young children that she couldn't go out of the apartment with. She was on a second floor apartment, and just the kids are, 7 and 9, something young, right? And our work together, she had no medical providers, no connection to anybody, had no supports locally. This was at the end of COVID, and her 2 community, family supports had died during COVID. So just so much trauma and hurt and terrible things. Anyway, fast forward to a year later, I was with her for 9 months, and then I handed her off to a longer term case manager. But a couple months after that, I received an email that she had lost 97 pounds, and I called her back and said, actually, you've lost 110, but because I had kept track, obviously. And she was in multi-system organ failure, and all that had corrected. She ended up, one of her goals was to have gastric bypass, but she had gotten to the point, she said, I don't think I'm gonna. I made it this far by myself. I want to keep going. This is working. Which was just for her to have that confidence and that commitment was amazing. And, she was always very appreciative to me, and I think I didn't really do anything, but I think seeing her as a person who needed help rather than just a problem was what started it.
Thank you, Jessica, for sharing that. I want to make a point, a big point, and I know I'm a little short on time. The reason I asked you all to share about these things that you felt really strongly about, that you felt it was one of those really good moments for you is, and it could be my opinion, but according to the research and the data, it doesn't, it seems to speak to providers not taking the time to acknowledge what they achieve, acknowledge those moments that feel well for them. They're so focused on the next one and on the next client and the next progress notes that has to be made and the next point of responsibility for you to be able to take a moment. I try to guide this, but for you to do this regularly. Take a moment out and say, look at what you accomplished. Look at what you bring. Look at how you feel when you can help another individual. Celebrate your own successes. That's part of a way, that's kind of part of a way where you can balance out so that the impact that all these other situations can have on you. Don't be afraid to recognize and pat yourself on the back. Okay? It's important that you do that. If you could do that for yourself, it's easier. It's not as easy. It's always so easy to look at someone else to see what they're doing. We don't necessarily control ourselves because it's not about us, it's about them. Well, it is about you. You can't do anything for them if you don't put yourself first. You have to. So recognize what you bring. Recognize what you are able to bring to support a community that is always in need and it looks so different all the time, and you're always consistently available. So this is one way to kind of mitigate some of those hopeless moments that we go through sometimes for compassion fatigue. Some of the ways to kind of stay away from compassion fatigue and kind of put ourselves in a position to kind of recognize, yeah, we're bringing this. Sometimes it looks different for every person, and it's supposed to. Sometimes what you can bring for one person can be extremely different from another person. Well, it's the fact that you bring at all, you know, and folks are able to move in any positive direction for themselves. Creating your own wellness plan, an action plan, as really thinking about your physical health to balance out. You have a slide in there that we covered about how to mitigate and how to balance out, you know, your work-life plan. It really should be life work plan. If you can take your work and then put it after life and emphasize your life is important so you can show up to work, start to challenge that thinking, you know, then you will look at these different areas of your life that can help you be in a healthy state of mind and a healthy place where you can listen and be able to be supportive to other individuals and still be able to take care of yourself at the same time. So your physical health, your emotional wellness, your me time is important. You have wellness days. And even without those wellness days, I would say those weekends should not be spent doing case notes, should not be spent preparing for Monday. Monday's hasn't gotten here yet. Don't think about that on Saturday night. Think about those things that you love to do. Think about your connections with other people who that speak to your identity, speak to who you are. You know, so that me time, those things, go hijacking, go hiking, go do all these other things that you like to do. If you can't do it realistically for whatever issue or not, but find something that is just pure joy for you. So building those new habits, maybe some of those habits you had before, identify those habits that are not as healthy anymore. And really it's about having fun, being able to have fun in your own life and bringing that energy with you. And so there is a slide here on wellness, balance, and connection and some provider resources as I promised. And I just want to say hope is more important because it can make the present moment less difficult to bear. If we believe that tomorrow will be better, we can bear hardship today. Well, it's the hope that you bring to your clients. Obviously, as you all shared, you know, it's the hope that you bring to your clients that comes from a healthy place. It doesn't come from a depleted spirit. It doesn't come from a low energy individual. It comes from someone who believes that, you know, they are in a place where they can believe that they can bring some support to folks in need, and you just share that. And so I wanted to, I know I still see Jessica's hand, but I wanted to bring you here. I wanted to thank you for all of you for being present for these 3 hours. Jessica, while we're doing this, if you want to add what I think you had something else to add?
No.
Oh, okay. Well, I just want to say thank you, everybody, for the fact that you have the tenacity to stay in this field and do the work you do. Now, think about what you can do for yourself. We're going into the holidays. Guess what? Holidays can be stressful too. Holidays and being around family and doing the cooking and showing that up at everybody's place. You know, don't forget to take moments for you. Appreciate the moment where you're at that moment and start to remember that you are part of the wellness and all that caring and empathy that you bring to the world. You're part of the world too. You need some of that too.